Hi everybody, this is Threadmaster Kay and I'm here at Kay's Corner. I'm very excited to interview a gentleman who has been in my life for a couple of years now because of somebody's very special, Carmen, one of my trainers. And we have Leno here, Leno Souza. He's in health and safety here in Ontario. And I want to tell you his story. Actually, I'm going to let Leno tell you his story. You, Leno, have dabbled in a little aesthetic medicine. Give us a background on what happened, where you started, where you ended up, and what we're going to do today.
Well, actually, this started way back in 2015. We had gone some trips to South America, and where I was already having some problems with my eyes and with my just my eyes at the time. We needed to get some work done on them, and we didn't like what we heard. So fast spacing over to last year or 2 years ago, I accompanied someone to Mexico where I met a doctor by the name of Dr. Valentin, and having been first diagnosed in Fort Erie with an eye specialist, I kind of didn't like what I heard. So Dr. Valentin in that time told me what he was proposed to do to my face and to my eyes in order to correct my my look and not having the need of having my eyes dragging and my face looking so droopy. The doctor said, "Listen, when you're prepared, I'm willing to work on you." So.
How old are you now, Leno? How old are you when you went in for surgery?
50 years old.
And you're currently
51.
Okay, so this is just recent.
Yeah.
Okay.
So the surgery actually took place on December of last year, where the doctor performed the surgery, and he realized there were some other little minor details that had to be fixed, and he did. And here's the result. After a few months, of course, there is some following up to do, which after surgery, we have to look after ourselves, and don't expect surgeries to fix everything because you do have to follow up with medication or treatments and stuff like that. So I've been brought over to Kay to do my next step.
So you've had facial construction surgery last year, last December.
Correct.
And that was with Dr. Valentine in Mexico. And he's amazing. Actually, I'm looking forward to seeing him later this year. We're going to do some thread work together. And I love it when plastic surgeons are on board with Threadlifts because I really believe that there is such a great area in aesthetic medicine just before you're ready for those people who want surgery. Maybe they're not quite ready for it or ready to jump to that, but it gives them a little stepping stone. So I'm excited to work with Dr. Valentine later this year, and I'm happy to meet one of his patients. So what I'm going to do is I'm going to show our followers and our viewers your before and after.
That's fine.
Your before picture and your after the surgery. And the reason why Leno's here today with me is because he's a gentleman who's actually taken the step to look after something that was bothering him. So you primarily went in because you didn't like your under eyes?
My upper eyes, actually, as a matter of fact.
Okay.
Because my eyelids up on top were puffing out so much that it was going to eventually cause a problem to me seeing.
Vision?
Exactly.
Okay.
And at the same time, the doctor, Valentin, had suggested, Leno, why do just the top when you can do your whole eyes?
Okay.
And I took that initiative. I said, you know what? Yeah. And then also at the same time, you also realized that the excess skin and the droopiness on my face was actually a result of my eyes sagging.
Okay.
So there was a few steps he had to take in order to correct the look of my eyes.
Okay.
And like I said, that's where I am.
Well, I've seen your before and afters, and it's phenomenal. But because to meet you here, you're 51, you said?
51.
So we're both the same age, and to meet you here at 51, I would never know that you had surgery. Like, the doctor was fantastic. I can't even tell. Like, usually when I do someone's thread lift, they try to tell me they've never done anything, but I can always see the incision marks. But when I look at you, they're just incredible. Like, I'm dumbfounded, actually. The work is incredible. So what we're going to be doing today is I'm going to do a 1-year maintenance. So many people think that they have facial plastic surgery and then they're good for years and they never have to do anything, which is a complete fallacy because here you are a year later and we're going to do a thread lift. So we're going to now augment a few of the areas, maybe along the jawline, a nasolabial. Maybe I'll just pop your cheek a little bit to give you a nice lift here, just open it up even further.
So like I said, after the surgery and after we did all our meetings, the doctor did recommend that when I went back home to actually meet up with you, because he does know you, and say you should maintain your surgery with some threads because they'll help maintain the look and keep my face nice and tight, because the older we get,
Yes.
also our faces naturally, with gravity, they start to fall. So I obviously don't want to lose all the hard work we put into the surgery.
That's right.
So, and I do want to keep looking good.
Absolutely. So that's the exciting thing. So we can do we can buy ourselves some years. And I mean, honestly, like I'm 51 now, you're 51. I haven't had a facelift yet. I definitely have not say that I'm not going to, but I'm sure that maybe I'll try in 10 years. Maybe like what I would have done in my 50s, now maybe I'll do in my early 60s. And so the threads will buy you some time before you decide to have surgery. And then, of course, if you do have surgery, I have a lot of patients. I'm just really happy to talk with you, Leno, because not only have you had a surgery, but you're also a man you're like from Portuguese, right? So you're from that Middle Eastern, Mediterranean, European community where sometimes guys don't jump to that, right? So I think that's amazing.
Actually, you hit the nail on the head, because being Portuguese, parents, old-fashioned, it's something that we were brought up back in the day that this is not something that a man should do. It's more for women, but really growing up, being surrounded by great people, and I started realizing that, I gotta start looking after myself. And it's not just looking after ourselves, material things. It's actually how do we feel?
Exactly.
How do we look, right? You know what? At the end of the day, we gotta feel great about ourselves. And it doesn't matter how we do it, but it's our appearance. And when I actually, after the surgery, when I looked at myself a couple of weeks later, I felt great. Emotionally, mentally, it was a huge boost. And you know what? I look forward to continuing doing what I gotta do to actually look great. And you know what? I do encourage men out there. You know what?
Absolutely.
This is not just for women. This is for men. This is for everyone.
Yes.
If you're down or something, look for something. And usually it starts when you do something to yourself physically, emotionally, and mentally, you're going to feel great at the end.
The thing is that we are living longer. Medical science has allowed us to live many more healthy years than our predecessors. And if you do something for yourself physically, if you look good, you feel good, and then you maybe act more youthful. Maybe you do more youthful things. Are you more active now since you had your surgery? Do you find that do you dance more or
age still creeps up a little bit physically, right?
Right.
But what I think out of the surgery is if you become more radiant, then actually other people around you are curious to see what really happened to you.
Right.
And they're interested to find out is, what did you do? And that's the thing is they look at me saying, what did you do? You look different. You're more vibrant.
Yes.
And you know what?
That the inner outer you, right?
Exactly. And if other people start to guess that, they're also interested because they got something in them that they want to change.
Yeah. And you're reaching out and you're being here with me today. Just for other gentlemen out there, it's just a boost for them, and I think there are going to be many people out there who are going to identify with you.
Yeah.
Okay, and so I'm very excited to take you to the operatory to do a refresher on Dr. Valentine's excellent work and to maintain what he's already done and to keep your spunk in your step, Leno. You have a spunk, I can tell, and I want to help you with that. So let's take you into the operatory, and then we will show you his before, after surgery, and then after 1 year later for his thread lift. Thanks, everybody.
Thank you.
So I'm going to soften nasolabials. I'm going to where you're the heaviest in this area. You actually have volume loss here, so I actually would recommend some amount of filler, which we can always do about a month after. So I'm looking to lift you. Your left side will look. Just turn your head this way. Lift you like so. You open up your eyes a little bit like that. Okay, and then smoothen out your jawline. Chin up for me a little, and then smoothen out your jawline and give you this type of lift. And probably in a month, so that's your before, and then that's your after. You see that?
Yep.
That's your after for today. That's what I hope to give you. All right, so after, before. And that should be about 30%. That amount of lift should be about a 30% lift and should give you that revitalization. I'm going to spend a little bit more extra time on the jawline because I don't think he did as much work here, right?
No, and after the surgery, which he says you really couldn't do much because of the swelling.
Yeah.
There's like a little puffiness here, which that was, like I said, after the surgery, the doctor really couldn't do much about that.
Okay, so I'm going to spend a little bit more time to give you a little bit more of a jawline here. Yeah, okay, sounds good. You can do it. So I'm using 2160s on him because men need a little lift. They don't need to have a cheek pop. Like, you don't want to make them look feminine. So you want to lift their mid-face, but you don't want to make them look like they just had cheek filler put in. So I'm just giving him lifting. I'm using a 2160 D3 suture. So it gives him a good lift, but doesn't give him a cheek pop that makes him look feminine. How are you doing? Okay, Leno?
Yeah.
So I'm going to press down now and just engage these sutures. There's a little pressure there, okay? There, that looks really good already. Okay, now we're going to take the biomesh and correct those nasolabials. I'm going to go and poke here. I'll ask you to open your mouth for me. Just close again. Look at that. You're gonna love it. $19,100. Everywhere. He needs it in his chin, he needs it in his face.
Wow. Bump's gone. Different.
Are you pleased?
Yes.
I'm going to take your picture and we're going to show you our result. Don't look down, look up. You look so good. Oh my God. Oh, it is emotional, isn't it? It is emotional because there's, wow, you look fantastic. Okay, for all the men out there, if you like my videos, subscribe. I'm so excited to bring you more of this amazing work.